Dear pet owners and their future veterinarians and practicing veterinarians. Today we are discussing a very important issues about the ectoparasites management in pets. A, whether this is a wise decision or just we are wasting our money as well as time. I am your host, Professor Dr. Mazhar Ayaz, Dean, Faculty of Veterinary Science, Cholistan University of Veterinary Animal Science, Bahawalpur, Pakistan. We will discuss about the detail its management in your pets, including your dogs and cats and other your pets. So, when we talk about the ectoparasites are external parasites or external bugs that live on our or on the skin or on the fur of our beloved pets. The common ectoparasites, they are fleas, a very tiny creature, ticks, mites, lice and flies. And by this we can have a broad knowledge and we will try to inculcate the basic needs of the management, why it is necessary to manage these external parasites and to get rid of these from our pets. As you know, the parasites are the biggest threat to the any pet's health or even the owners. There are two kinds of parasites. One are called internal parasites, they live inside the body, and other are called external parasites, they live on the skin of the animal externally. Those that live inside a pet's body, they are internal parasites, while those that stay over the pet's body are called or termed as external parasites. These parasites cause various diseases to the pets, including dogs and cats, some of which often turn out to be fatal. Thus, treatment of parasites is one of the most important aspects of any pet's routine health care. So, the most of the time, the vets are consulted about the control of the parasites, and so it is very much important that we may preserve our pets from the parasites. The first of all, we will talk about the fleas. These are the most regular pests or bugs seen on any furry animals. These are teeny brown colored pests that live on the skin of dogs and cats and sometimes on the goats and on the birds. These blood-sucking external parasites live their entire life on the host body. In addition, they reproduce on the host body and lay numerous eggs. They cause itching and then skin becomes sores and hot spots are the common symptom of the fleas. A wide range of the flea preventives including collars, shampoos, chemical spot-on, natural dips, etc. are available to get rid of these fleas from the pet's body. If we see the life cycle or biogram of the flea, they lay their eggs, the adult fleas lay their eggs, then they become the larvae and they pupate and then they become adult. And these all stages, they are evolved around our pets, including dogs and cats. And mostly, if we keenly observe around the dogs or cats' beddings, we can see these pets crawling. The anatomy of these fleas is mostly their tiny, wingless, and very hardy insects that feed on the blood of the pet, of the host, that is your pet. And even sometimes, accidentally, they may bite the owner, they may bite you. So, What are the common signs the that we can observe? That is itching, redness of the skin, the hair loss is observed, and there is uh, you can see visually with your naked eyes. Health risk associated with the fleas, they can cause dermatitis, flea allergy, and sometimes the infestation of tapeworms can also be caused by these fleas. Management techniques for the fleas contains topical treatment, oral medication, flea collars, and if still it is needed, you may consult to the veterinarian for the right product for your best animal. Sometimes they may cause a zoonotic problem. Zoonotic is mostly the problem that is caused from animal to the human beings, and sometimes vice versa from human beings to the animals. The flea infested pets may become infected with the tapeworm, that is Diplydium caninum, and they are ingested sometimes while grooming. And children and sometimes rarely become infected with Diplydium caninum, that is a tapeworm, from inadvertently ingested fleas. Some intestinal parasites, including roundworms and hookworms, can also cause disease in people. They can be infected from your pets. Flea-borne or murine typhus is a disease caused by the bacteria Rickettsia typhi and like cat scratch disease, Bartonellosis. Flea-borne typhus is spread to the people through contact with infected fleas. Most commonly, the oriental rat flea, that is Xenopsula chupis, and the cat flea, that is Tinosyphilis felis, causes these plague. The other infestation of external parasites is caused by the ticks, and they also suck the blood and which cause fatal diseases like Rocky Mountain fever, Lyme disease, and tick paralysis, and some others. Some of the tick-borne diseases, when left untreated, may result in the death of your infected pets. There can be the itching, scratching, and the crawling of the ticks around or on your pets. Regular tick check along with the use of spot-on shampoos, collar helps in combating the ticks. Choose a treatment with tick repellent effect. It would prevent ticks from sticking on the pet's body. If you observe about the life cycle of the arachnoids that attach to feed on the blood, and among them there is ticks are attached and engorged, so it is better to remove them safely. Health risks associated with these ticks, there can be tick-borne diseases include Lyme disease, anaplasmosis, babesiosis, and ehrlichiosis. So you may check on regularly for the prevention of the ticks. Mostly the whole family of the male and female ticks reside on the host, and because they crawl they can leave the host and may live in the beddings or in the houses or on the kennels. Management techniques for the ticks, that can be the tick control products, collar, vaccination, if some in countries are available, in some countries they are not available, and there is environmental management. As you can observe, the female ticks lay their eggs, then they there can be thousands of the eggs at a time, then they become larva and then nymph and then become male or female. So they can be equally responsible for transmitting babesiosis and ehrlichiosis in the pets. Regarding zoonotic infections that can be fatal for the owners also, there are among the most diffuse vector-borne diseases, and mostly they are caused by the microorganisms including Babesia species, Borrelia species, Rickettsia, Ehrlichia, and Francisella tularensis, Coxella brontii, and tick-borne encephalitis virus. So these are the potential threat to the owners of the pets also. The next is the mites. There are several types of mites including ear mites, mange mites, sarcoptic mites, demodex mites. They may attack dogs and cats, and these pets may live on the skin of the host. They create deep burrows into the skin, bumps, cankers, and crusty skins. There can be observed itching, inflammation, sore, hair loss, and foul discharge are some of the common symptoms that can be observed. Among the mites, the ear mites, they are found in the ear canals of the cats and dogs, and these creepy creatures cause severe ear infection or otitis. They are highly contagious. Ear mites cause itching, abrasions, scratching in the pet's ear, inflammation and abrasion at the back of the ears are a result of these mites. We use a gentle ear cleaners to wipe the ears and then treat as per vet's guide, and these are observed with the otoscope. The demodex mites, these are they pierce into the spacious glands and hair follicles of the cats and dogs, and there are symptoms of inflammation of the skin and hair follicles. The insecticides, including ivermectin and amitrose, are the highly useful in treating these non-localized infestations. The third one is the sarcoptic mites, popularly known as itch mites. These scabies infest cats, dogs, and their human beings or owners, and their other animals, horses and cows also. They burrow pets' skin and create dry, crusty, patchy lesions. Hair loss is the most common symptom, and their coat is rough and with their any shine or luster. This is the most common symptom. So sometimes it is not treated in the beginning, then this can spread across the pet's body as well as in the kennels also, where the most of other or catteries where the dogs and cats are left for breeding. If you observe about the biology and types, there are sarcoptic, demodectic and sauroptic mites. The life cycle is same. The female lay their eggs, then they become larva, nymph and adult. And these, the hatching of these adult egg to larva, that depends upon the species, temperature, environment and humidity. Here you can see the various pictures of these mites infesting your pets. These teeny creatures are arachnids. They cause skin lesions in pets. There can be itching, hair loss, skin inflammation, and health-associated risks with mites. They are sarcoptic and demodectic mites. Early detection is advisable and properly treatment is suggested. Regarding the management techniques of the mites, treatment or options are shampoos, topical ointments, oral medications with the help of veterinarians is suggested. Regarding the zoonotic infections, acariasis can occasionally be transmitted to the humans by the incidental contact, producing pruritus and dermatitis. Animals such as dogs, cats, mice, birds, and reptiles harbor several mite species including goats. Home, the hemophage mites and those that feed on lymph have the potential of transmitting important zoonotic agents also. Next comes the lice, and this is the most commonly observed pest or the external parasite, especially among them is the chewing lice. They are famed for biting the skin layers of the host. They cause itching, irritation, and result in matted coat. Their bites are painful for the pest and make them restless. Flea treatment with lice control are commonly availed to destroy these pests. It is important to treat the pet's bed to eliminate the lice, and also they are commonly showered to get soothed from these chewing lice with the help of shampoos. These lice, these are small wingless insects that live on the skin and they feed on the blood. And their mostly signs is intense itching, hair loss, skin irritation in the dogs and cats. Health risks associated with these are the discomfort and potential secondary infections and blood loss. Management techniques for lice and the treatment options include medicated shampoos, topical treatments, and environmental treatment also. The biology of the lice, including chewing and sucking lice, can be observed in dogs. There are two types of lice, sucking lice and biting lice. About chewing lice, they are called Trichodactylus canis and Heterodactylus spinniger, and the sucking lice, they are called Linogenathus cytos. In cats, there is just biting lice. The sucking louse in the dogs are bloodsuckers, so in large infestation in very young and small or old dogs, significant blood loss can occur. In the majority of cases of lice infestation, the bites from the lice simply irritate the skin, and the main complaint is excessive itchiness, oftentimes associated with excessive white flakes on the coat of the animals or in pets. The lice in dogs and cats, especially chewing, is the Malophaga and sucking is the Anopleura. That lice occur on the dogs and cats worldwide. In Canada, dogs are host to both sucking and chewing lice, including Linogenathus cytosis and Trichodactylus canis. And the cat is only infested to the chewing lice. There is Felicola subrostratus, which are most commonly seen on farm cats. While lice are more or less host specific, they will sometimes camp on a atypical host. The human pubic louse, Pithras pubis, known as the papillons d'amour or butterfly of love, is sometimes recovered from dogs and cats, and it is very much important to communicate to the clients also about this infestation. Regarding flies, the side flies are the most important. They predominantly found in the tropical regions. These flying blood-sucking pests are a typical potential threat to cats and dogs. They don't live on the host but bite them whenever they land on themselves. So they live nearby musty areas covered with lot of uh, stuff as well as with the dry leaves and with some humidity. Sandfly bites can cause life-threatening disease, that is leishmaniasis, and especially in cats and dogs. They may result in anemia, kidney failure, skin irritation, and weight loss. Shampoos and lotions are the best method of treating these pests. Some flea and tick preventions can also be eliminate the sandfly. The leishmania infantum occurs in dogs and cats, as you can see in the pictures, and also leishmania cutaneous in the human beings, especially on the exposed area. They do have also zoonotic species of filaria, including Thalassia calipeda, that is mostly eyeworm. They also they performed testing for lien evocative of sarcoptic mange of dermatopteris, that is mostly deep skin scrapings, and chilitrilosis, that with the help of tape test, or photoacariosis with the airwax, we can also observe the other parasites also. The heartworm, that the Dirophilaria immitis, mostly spread through the bite of the mosquito, that is very difficult to treat, and sometimes they lead to the death of your beloved pet. So the Dirophilaria immitis that is the filarial worm that live in the heart, inside the blood, and by the clogging the veins and arteries and heart, that may lead to the sudden death of the pet. The filth flies, cockroaches, and dung flies, they also play an important role in Ascaris, Trichiurus, Entamoeba, and Cryptosporidium in your pets. Here it can be also infected, vice versa. Hippobosides, these are strong, robust flies that live on the skin of your pet, and they play a very important role in the transmission of Bartonella. The very important thing is to know them and save your pets. Numerous external parasites are a potential threat to your pet's well-being. It is important to know them and to prevent them. Proactive measures may save your pets from contracting diseases they are caused by these creatures. So know the enemies of your pet's health and get rid of them by proper treatment and proper care. The Lyme disease in dogs can also be infected through the ticks, and it has been forecasted in USA for 2023 the spread of the Lyme disease. So prevent your animal, your pets from the ticks, and if you observe lameness, swollen lymph nodes, lethargy, difficulty in breathing, stiffness, lack of appetite, fever, and sensitivity to touch, you may contact your veterinarian for the Lyme disease in the dog. Regarding the prevention and treatment, or to save your animals and save your pets, the drugs like permethrin, lindane, benzyl benzoate, glutamate, sulfur, diclofenac or DDT, and ivermectin are commonly used. The permethrin, that most convenient drug for scabies and lice, that acts through delayed depolarization, neurological paralysis in the insects. So minimum systemic absorption has been observed. Nearly 100% cure rate in scabies and pediculosis or in lice infestation. Single application is needed in most cases, and there is recorded no development of resistance, but you will be very much careful that animal may not lick these medications, and it may not touch any wound or into the eyes or in nostrils or into the mouth. So it is very much important to know about the precautionary measures. Then is the lindane that affects the nervous system of the insects for head lice and scabies. Single treatment is needed. Efficacy is lower than permethrin. Both lice and mites can develop resistance to the lindane. So, in combination, lindane and benzyl benzoates are treated to cure up to 100%. Sometimes it may be observed systemic toxicity in the animals. So, a very careful use of this lindane is advised. Benzyl benzoate, these are aromatic compounds for the scabies, and its use is very convenient even in children, and this is second choice for scabies and cannot be used for the lice or pediculosis in the pets. Glutamate, that is effective against scabies, lice, and against itching, and also preferred in the children if they get any infection, but it may be used with full care. Ivermectin, this is anthelmintic drug used for scabies and pediculosis and even for ticks. Only oral administration is advised for ectoparasites in dogs and cats at the dose rate of 0.2 mg per kg body weight in a single dose. So, uh, patients with immunocompromised disease, they also respond with this, and children with 5-year age or with pregnancy and lactation must be used with care. And this first line of treatment for scabies, pediculosis, and for the ticks also. The recently developed medicine fluralaner can be injected against the ticks and for the fleas in dogs and cats, so that can protect your pet up to 12 months efficacy against Tenosyphilis and Rhipisyphilis sanguinis. So this is also very much important to protect your animal throughout the year. Here are you can also visit Veterinary Problems and Solution channel where you can like, subscribe and share for further informations and necessary management practices. If you have any question, please don't hesitate to ask at this WhatsApp number. Thank you for your patience.